provided them with cooking strategies. So it was really tailoring their behavioural barrier and adding in that layer of behavioural support. So they had to rank their barriers in terms of first, second and third, and then we could tailor the behavioural support to them.
Can you maybe introduce a bit yourself? Tell us a bit more about your background and your role in Planet.
Okay, so hi, I'm Lauren Devine. I'm the Post-Doctoral Research Fellow on the UCD Planet project. So a little bit about my background. For my PhD, I was very focused on implementing positive dietary behaviour change among adolescents within the school setting. So then when I joined Planet, I was really interested in bringing that research and that knowledge towards Planet and to implement positive dietary behaviour change within the university setting among young adults, which is our primary target group. So on our day-to-day, our ultimate goal within the UCD Planet Living Lab is to understand young adults attending university, their dietary behaviours, what influences their food choices, are there any barriers or enablers to eating more sustainably, and then developing solutions with both our students and our key stakeholders to help support that transition to more sustainable and healthy dietary behaviours within the university setting.
Why, according to you, is the university setting a very good context for such a living lab and project?
Yeah, I think the university setting offers a really unique opportunity for implementing living labs. So I guess just one point is that within the university setting, you have access to a wide range of facilities. So within the university setting, we can access education, there is food services, food service providers, we have accommodation, we have retail and leisure. So I think with that comes a very diverse staff profile as well. So you can more actively engage with food service providers, academics, researchers, policymakers, and that really helps buy-in for interventions like this within the university setting. As well as our stakeholder of being able to involve different environments and a diverse profile of stakeholders. We can also have a large reach with young adults who are attending university. So thousands, there's a huge proportion or large proportion of young adults population attending university. So this gives us a very unique opportunity to reach them and engage with them who are attending campus usually on a very regular basis. So for example, within UCD, we have over 38,000 students on campus. So it really gives us that unique opportunity to engage with them. It's a very prominent life stage to try and target. So if we look at students, they're in a sort of transitional period and what's often termed as emerging adulthood. And at this point, they're gaining increasing independence with regards to both like finances and their dietary behaviours and autonomy over their food choices. So it's a really key opportune time to intervene and work with them to establish healthy eating behaviours and sustainable eating behaviours at that sort of a formative life stage, which then can be carried into later life with them. So it's a key point for intervention. And I guess another unique opportunity of having that within the university setting as well is that we, within the Planet study and also other universities, we have access to the students over quite a long period of time. So a unique part of having the Living Lab on campus was that we were able to engage with our students at the start of the project, and we gathered information around their dietary intakes and their dietary behaviours. And then we've been able to engage them throughout the duration of the Living Lab project. So that was over 2 years. And now we're able to look at as we come towards the end of the study, we can reevaluate those different metrics and see how we established any change. So it really gives us that long-term access for that population group.
That's great, thank you. And how did the university students respond to Planet when you tried to reach them, to engage them in the project? Were they motivated or were they not that interested? How did they respond to this topic?
Yeah, I think on UCD campus, there's a very positive culture around sustainable and healthy eating. There's been huge buy-in from both our students and also our stakeholders. So I think that's really nice to see. There's definitely a drive. They want to promote more sustainable and healthy eating practices on campus. And I think they were really engaged. And what really encouraged them to get involved is that their voice was central to everything that we wanted to do. So we wanted to hear what they would like to see on campus. What are their main barriers? So I think that was a big incentive to getting them to want to sign up and join the Living Lab and almost join this movement towards creating a more sustainable and healthy campus together with us and our stakeholders. There was a great buy-in from our students. What we did as well was that we tried to be as inclusive as possible. Our university is a very large setting, so we did try and promote the study as wide as possible. So beyond the students who would typically be interested in a study like this, who, for example, those studying nutrition or studying sustainability, we did try and promote it as wide as possible to the student body. So there was good interest. The only barrier that comes with student engagement is, of course, one, they're attending university, they have a very intense academic timetable, and they also are juggling multiple extracurricular activities. So we have to be very mindful of that whenever we're working with groups like this. So I would say, in terms of constraints to engagement and involvement throughout the study, that would have been the biggest barrier that was reported back from our students. And that also, we are restricted by academic timetables, for example, per our trimester. So these would run in a certain number of week period. And then we also have to take into account that they may be preparing 3 to 4 weeks at the end of the trimester for their exam period. So this all impacts engagement with a study like this. But overall, their general interest did seem to be there, which is great to see.
That's great. It's so nice to have this, yeah, motivation and atmosphere. So that's great. And could you tell us maybe a bit more about the results of your living labs? Like for example, around the barriers to change dietary behavior, or maybe around one or two interventions that you tested or are going to test to change dietary behavior?
Yeah, of course. So in terms of the results, we did run several studies. I'll maybe talk you through one example or two examples, but in terms of our results, so whenever the students joined our Living Lab, as mentioned, we would have collected a range of different information from our students. So we looked at their demographics, their health, their lifestyle. We got information on their dietary intakes and their dietary behaviours. And what we could do with that information is, number one, see what type of food groups were our students consuming and what sort of food groups then did we need to target throughout our Living Lab process. So using that information, we then combined that with collecting a lot of information on what students reported as barriers to specific food groups. So one example that I'll pull out is that, number one, we could see that across our cohort, there was a relatively low intake of legume consumption. And then with the other data that we collected, we would have received information from the students on what were their key barriers towards consuming legumes as a population group. So what were the key barriers that stopped them from eating those types of foods? Um, in terms then of what we've done with that information, so that information was key that we could tailor intervention accordingly. So we designed initially as a pilot study a personalised nutrition intervention. So building on previous personalised nutrition interventions and standard dietetic practice, we also layered on a additional aspect of tailored behavioural support to increase legume consumption across students. And what we did was we got the students to report on what were their main barriers to legume consumption, and using that information for those who were assigned in the RCT to the intervention group, we would have then given them, as well as the standard personalised nutrition information and the dietetic practice that comes with that, we would have then layered on an additional layer of the behavioural support. So, for example, if a student had reported convenience as their biggest barrier to legume consumption, then we could have added in the layer of tailored behavioural support to actually provide the students with legume products. Or, for example, if a student reported that they had their biggest barrier was a lack of knowledge and maybe how to cook these foods, then we provided them with cooking strategies. So it was really tailoring their behavioural barrier and adding in that layer of behavioural support. So they had to rank their barriers in terms of first, second, and third, and then we could tailor the behavioural support to them. So this was a very interesting study, and in terms of our results, that we find that adding in that layer of tailored behavioural support was effective and more was efficacious in increasing their legume consumption. So it was really positive to see those results whenever we compared it to your standard personalised nutrition trials and standard dietary practice. So it also had positive findings as well, but it was great to see that once we add in this tailored behavioural support, the positive impact that can have on students' dietary behaviours. So that would be an example at the sort of micro level. intervention that we ran within in terms of findings within our living lab. Um, Other key findings would have been that we got a wide range of feedback on what are the barriers and enablers to dietary behaviours, to sustainable and healthy dietary behaviours for students on campus. And then we also had this feedback from stakeholders as well. And what we did is that we also asked both our students and our stakeholders what solutions then would they like to see on campus to help them overcome these barriers and improve sustainable and healthy eating on campus. And one of our key findings, I guess, was that we brought all of this information together in a workshop where we actively co-created with both our students and our stakeholders to what is called a behavioural systems map. And essentially this really highlights who are the key actors who should be involved on campus, what are the key behaviours, and what are the key influential factors and their interrelationships. So we've been able to use all of this data to create this behavioural systems map to identify where on UCD Belfield campus can we implement change and what impact that can then have on the rest of the UCD food system, and then what impact that has on students' dietary behaviour. So these would be two examples of key findings that have come out of our study to date.
And did you do, for instance, like cooking classes as a solution for students who don't know how to cook, for instance, or?
No, we didn't do the cooking classes. We did get a lot of feedback from students that they have restricted timetables, and everybody's timetables were different, etc. So what we did was cooking skills did come out as a barrier from our student cohort, but to make it more tailored towards and as accessible, I guess, to the student population, the cooking demonstrations were then videoed and uploaded online, and then students could access them. So that it meant that they were able to go in and access these videos in their own time and whenever they needed them. And that was part of our personalised nutrition intervention. So those videos came into that, and which were then provided to the students.
To conclude, maybe can you tell us a bit more about the future of your living lab, what you imagine for the following steps of your living lab?
Yeah, so I guess there's huge scope. So as I mentioned, we've ran our personalised nutrition pilot study. What we have then done is we have scaled that up. So it was focused on increasing legume consumption, but we've now broadened that out and ran it on a larger scale to target other key food groups that are essential to achieving a sustainable and healthy diet. So that's coming towards the end, and we're very excited to see the results for that as well. So I think number one, there's scope to keep building on the personalised nutrition aspect, incorporating in that tailored behavioural support as a next step, and where that can what steps we can take with next. As well, as I mentioned, we developed this behavioural systems map. So we have identified a huge range of factors that influence students' food choice on campus and their dietary behaviours. We also identified a range of solutions that both students and stakeholders viewed as feasible and acceptable for implementation on campus. And we got both of our groups to rank those in terms of feasibility and priority in both the near future and the longer term. So we have a wealth of information that I think that now that we've gathered all of this information, we know what the students and the stakeholders would like to see. The next step is trying to see where can we bring this forward in UCD campus. So sharing that with our policymakers and seeing if there's any scope to trial any of these interventions or move them forward in the next step.
Well, thank you very much and congratulations for all your work.
Thank you.